Communicating with uncommunicative patients. Pada sebelumnya kita sudah membahas what are the challenging patients. What challenging patients are? There are 14 challenging patients based on Warwick University. One of them, the patients with communication barriers. That's one of the difficult patients to face. Okay, here are tips for uncommunicative patients. If a patient is not very responsive, it may be more appropriate to use closed questions. The closed question means the questions that answer is very limited. It is like a yes, no answers only. So the patients do not need to reply the questions by giving explanation or something else, but the patient just say yes or no. This is one of the tips for uncommunicative patients. The doctor should use closed questions. The second tip is when talking to a depressed patient, acknowledge the patient's difficulty in talking by saying, I can see that this is very difficult like that. So you just need to say, show that you acknowledge what they feel, or say that you understand what they are facing. And then show empathy by leaning forward and ensuring you maintain eye contact. It is important for the medical doctor to do the nonverbal communication, like leaning forward to show that you respect the patient, and then you try to be listening what they are feeling, and ensuring that you maintain your eye contact to your patients. It can create kind of a focus, so the patient will feel that you are focusing on he or she, on him I mean. And then here is the sample of conversation. The doctor said, "Tell me, Mary, how are you feeling at the moment?" And the patient just kept silent. "This is very difficult for you to talk about, isn't it?" "Yes." "Are you still getting the headaches?" "Yes." "And do the painkillers I prescribed help? Have you been taking them, Mary?" "A couple of times, but they knock me out. I can't function properly with them, and I need to look after the family. They need me." "I know. You have a lot on your plate at the moment, don't you? Nursing your husband, taking care of the children, and looking after your mother." "Yes, I feel overwhelmed." "I'm sorry, doctor." "You don't need to apologize, Mary. It's perfectly normal to cry. I understand how you're feeling. You're worried that if you don't stay strong for the family, things will fall apart, aren't you?" "Yes, I can't let that happen." This is the sample of the conversation between doctor and the patient. And from this conversation, we can learn how the doctor uh, gives the question to the patient, and we can see the response of the patient. The patient The patient was in a difficult situation and having the headaches. So it's a kind of a complex problem that happened to the patient. So the activity for you is identify closed questions and identify the acknowledgement created by the patient related to the patient's difficulty. So there are two tasks that you must finish. The first is identify the closed questions, and then the second one is identify the acknowledgement said by the doctor. That's all. Thank you very much. See you.